here with Dr. Bob Gallagher, who is an interventional cardiologist at the Walter Reed National Military Medical Center. Thank you so much for being here.
Thanks for having me, Pallavi.
So my first question for you is, can you tell me a little bit about your journey into medicine and how you ended up being a cardiologist?
So there's a few ways people get into military medicine. The most common, I would say, is probably people go to college, a normal route. Some people might do ROTC, but most probably don't who end up in military medicine. And then many people use some kind of military scholarship to pay for medical school, and they end up in military medicine that way. My way was a little different. I went to the Naval Academy for college, and so I was kind of entering the military regardless of whether I chose medical school or not, or chose to go into medicine or not. But going through the Naval Academy, I ended up having the opportunity to enter medical school directly after graduation there, and went to the military's medical school, which is called the Uniformed Services University. It's here in Bethesda, Maryland, and entered that way.
Nice.
Yeah.
And so how do you think kind of your military medical training differed from a traditional medical school path?
So kind of like what I said, it depends how you enter, but the way that at that medical school at the Uniformed Services University, there's a lot of military training built in to the medical school curriculum. Most of at the time and still today, I think most of the medical school parts of it are the same as other medical schools. So you'll take the same kind of classes, the same kind of anatomy labs, all of that. But in between that, and certainly in the summer times, there was a lot of outdoor military training exercises where you would go to like a army base and have wartime drills of setting up a combat hospital and doing those sorts of things, which was really kind of cool thing to do when you're at that age of your life. You're 20 something, and getting to do those kinds of things was a lot of fun and very unique compared to other medical schools who don't do that stuff necessarily.
So what part about cardiology made you interested in pursuing that part?
Cardiology, I'd say I was kind of interested in medical school. By no means did I grow up knowing I wanted to do anything particularly. Didn't want to be a cardiologist as a kid necessarily. I probably didn't know what that was at the time. But in medical school, I kind of got interested in it, and then I really got committed to it when I was a resident and starting to rotate with cardiologists and take care of those sorts of patients. One of the big experiences I had in medical school that probably pushed me that way was they had some programs where you could meet with different specialists and sort of hear about things and ask questions. And at the time, I was very interested in hands-on types of medicines, like doing procedures or doing surgery. That's just kind of my personality or temperament was kind of in that line. And I ended up having lunch with a cardiac surgeon because I thought maybe I want to do heart surgery or some kind of surgery. And he was kind of like an older surgeon at the time. He was kind of near the end of his career, and he had seen a lot of the evolution of the field and different things that were happening. And he was very honest with me and said, there's a lot of things in cardiac surgery that are becoming done by cardiologists. A lot of the procedures are becoming minimally invasive, and they're not necessarily open surgical procedures. And that really opened my eyes to the idea of interventional cardiology and doing procedures on the heart without open heart surgery the traditional way. And that's kind of the way my career ended up going.
Nice.
So that was kind of cool.
That's so cool. So I understand that you worked with the U.S. Navy as an undersea medical officer. Can you kind of explain what that entailed and some memories from that?
Yeah, so undersea medicine, it's a very unique thing. It's very unique to the Navy. It's a field where they've kind of found a way to have doctors serve with specific units in the Navy that do certain things. And so it's basically submarine medicine, so people who are on submarines. All of our Navy submarines are driven by nuclear reactors, and so there's radiation health pieces of this, and there's some other pieces that involve being isolated in a submarine underwater for months at a time comes with some health and psychological factors that they needed people to handle as medical providers. And then it's also diving medicine. So there's deep sea divers for the Navy and special operations forces like Navy SEALs that can get certain diving related injuries like the bends or decompression sickness. And so the Navy has programs for treatment and management of that. And so it's kind of a unique thing. It's mostly done by doctors in the Navy who are in the sort of early parts of their career. You get trained in some of these fields for during a specific program, and then go to different jobs doing it. So when I did that, I had finished my internal medicine residency at the time, and I had been trained in undersea medicine. So I went to South Carolina, where I was working with some divers and some submarine units, and taking care of those guys. Got to ride submarines, got to do some deep sea diving. So it's kind of a cool thing to get to do.
Definitely. A different part of medicine that you don't always hear about.
Yeah. And so the military has a few of these niches. So that's one of them. Flight surgeons is another one. So I think really all the military services have flight surgeons, but especially in the Navy and the Air Force where there's lots of pilots. You get to learn how to take care of people who fly aircraft, and you usually get a little bit of flying experience doing that. And there's a few other little things that are valuable to doctors in the military that are unique. Yeah.
So now that you're at Walter Reed, can you kind of give me a tour through your day? Like, what are your daily responsibilities like?
Yeah, so right now I'm an interventional cardiologist at Walter Reed. Most weeks, I guess, I have a few different types of days. So some days are just normal doctor's office type days where I'm in the clinic and seeing cardiology patients who are either referred from here in our local area. In the military, we see both active duty military folks as well as their dependents. So they're, oftentimes it's their spouse or partner and their children. But it's also retirees of military service. So we see a lot of older people with cardiac problems for that. Other days I'm doing procedures in the cardiac cath lab. So for me, that's putting in coronary stents to open blocked heart arteries, or sometimes it's structural procedures to implant new heart valves or close holes in the heart and things like that.
Wow, that's really cool. So how do you think your military background has kind of influenced your approach to patient care?
In some ways, not at all. So I think in a lot of ways what I do is very similar to what you would find a cardiologist doing in civilian medicine. So like what I just described, I think, the ways we treat patients is very similar. The ways that it's different and unique probably involves a lot of occupational medicine type things. So we get a lot of questions about certain service members or certain patients with heart conditions, whether or not they can be deployed around the world. Is it safe for them to go off to the middle of nowhere where there may not be a lot of hospitals around? And having to make those sorts of decisions is very different than what civilian cardiologists might do. We also have a few unique things we do in medicine in the military, and especially at Walter Reed, that's a little different. We take care of a lot of patients from the White House and from Congress and things like that. Get referred to us because it's all within the federal government here in the DC area. And we oftentimes travel with those groups when they go overseas. They'll ask for doctors to go on these trips to make sure that anything that arises can be handled. So that's kind of unique, and meeting a lot of those people is kind of interesting. You're almost a little bit of a part of history during some of these trips and some of the people we meet and take care of.
That's really cool. So what parts of your work and work life do you really enjoy, and what kind of drives you in your career?
I think the pieces I've enjoyed the most are taking care of patients in new ways. So sort of what I described about doing things that used to require open heart surgery. We're now replacing heart valves and doing things in ways that are much easier for patients and available to patients who used to not be considered candidates for treatment because they were too sick or too old for open heart surgery.
Yeah.
Now we can help those people live longer and feel better, which is a very rewarding thing.
For sure.
Yeah.
Yeah. And so I guess on the other hand of that, what kind of parts of your work frustrate you?
Frustrations, I bet, are very similar to most doctors and even in civilian medicine. It's mostly the things that come with large organizations, like the bureaucracies and the almost corporate nature of some of what we do in terms of managing schedules and working within large hospital organizations and things like that. Specifically in the military or in the government, I think some of those things are heightened in terms of budgets and things like that. We're very reliant on Congress to pass the defense budget to run our hospital, and it seems like it's different every year, and many times we can have gaps in funding within the government, which is probably not felt the same way in civilian hospitals. So that's, I think, an added frustration that happens in the government.
Makes sense. And so are there any expectations that you've kind of had about your career that were different from when you first started out, or turned different from reality?
That's a good question. I think that when I was young and starting out, I assumed everything would be the way that I saw it happening to my elders or to my role models and my mentors. They were doing what I'm doing now. They were, kind of senior in the cardiology community in the military or at Walter Reed, and I sort of aspired to be like some of those people, but the circumstances have changed in some ways that they never had to deal with. So I think I sort of expected that the military would always have the same kind of staffing and funding and things like that, and those things have really waxed and waned over the years that I've been around, and that's created a little bit of frustrations or unmet expectations. Not always in a bad way, but in ways that have been sometimes challenging and required me to be more flexible than I might have expected when I was 25 or 30 when I was sort of first making some of the decisions to do what I do now.
So you've talked about kind of how you've seen the field of cardiology evolve since you first started practicing. How do you think it will evolve for future generations?
I think there's really no question that it's going to keep progressing in a way that is less invasive, and we're going to be treating more patients that currently sort of have few options. I think there's a lot of, biotechnology is advancing very quickly, and much quicker even than when it was when I was starting out. And so I think we're going to keep seeing procedures getting simpler and safer for the heart, and hopefully even less and less patients are going to require open heart surgery, and they're going to keep having more options for procedures and things going forward. So I think that trend will continue. There's no reason, at least right now, to think that's going to change, and I think there'll be a lot of opportunity for young doctors to do those things and to go into these fields going forward.
That's great. So what advice would you give somebody who eventually wants to go into military medicine or cardiology, or what is the best advice you've received in regards to your career?
I think I would advise people, if they want to be in military medicine, I would let them know that there's different ways to do it. So I alluded to some of that in the beginning, but you don't necessarily have to go to a service academy. You don't necessarily have to go to Uniformed Services University for medical school. Most people don't. Most people have other ways that they do it. But those are really good options for people to do it. And a lot of people are able to do it. Like I was able to do it with zero tuition and zero student loans. You owe a lot of time in service. That's kind of the way, that's kind of your student loan. That's the way you pay for it. But there's very good options to do that. if it's right for you.
Mm-hmm.
So there are some people who do it just to get medical school paid for and things like that, and then
Mhm.
they're unhappy
Yeah.
because maybe it wasn't for them to be in the military afterwards. So I think that would be the biggest piece of advice, is make sure that's for you. Get some experience with what it's like to be in the military and what options might be available to you, and get into the weeds with it, because
Mhm.
there's a lot of differences in the different services too,
Yeah.
in the Army or the Navy or the Air Force. And so it makes sense to talk to people who have done these things and learn what might be right for you, or maybe find out if it's not right for you and do something different.
Well, thank you so much for doing this. I learned a lot about just all the different opportunities in military medicine.